People ask me all the time how to bring up the issue of weight with their loved ones. With an obesity rate in this country quickly approaching 50%, chances are pretty good that there are multiple people in all of our lives living with excess weight. When we care about people, we worry about them. It's human nature. Many of you listening to this right now have gotten your weight and your health under control, which feels amazing. And it's human nature to want to share that feeling with others. However, for many people, weight is a touchy subject. We can't just start telling everyone they should jump on board like we do when we visit some new travel destination or find a new fabulous hairdresser. Some people don't want to talk about weight, ever. Some don't want to talk about it right now. Some don't want to talk about it with someone who no longer has excess weight. This can be due to many different factors. It may have absolutely nothing to do with you. It may have a lot to do with past experiences. Most people with excess weight have made attempt after attempt to lose it over the years. Most have been on the receiving end of bias and stigma because of their weight. You can't look at someone and immediately tell that they suffer from heart disease or arthritis or HIV, but the disease of obesity is visible for everyone to see every minute of the day. Years of living with internal and external biases can lead to a great deal of shame. People don't like to talk about things that make them feel ashamed, especially when the discussion is with someone else who has never felt shame around that topic or has, in a sense, overcome the thing that's at the root cause of the shame. However, because it's human nature to want to share things with others when they have improved their lives, and because we care about the people in our lives, we often want them walking alongside us as we get healthier. So I thought I would put together a few tips for addressing this issue with people that you care about. First, do ask permission to talk about it. This may seem awkward at first, but it's actually a wonderful way to approach the subject, and it gives you both an opportunity to walk away before feelings get hurt on either side. Simply saying, "Can we talk about your weight?" gives them the freedom and agency to decide if they don't want to talk about it, and saves you the time and energy it takes to repair a failed conversation. 2, do tell them why you're bringing it up. If they agree to have the conversation, let them know that it's because you care about them. It may seem obvious to you, but most of us are emotional, illogical creatures. Some of us hide it better than others. And when discussing something that comes with a lot of emotional baggage, we can quickly go down a rabbit hole, thinking that the conversation was initiated because of embarrassment or shame. Now, don't preach. People with excess weight know they have excess weight. They also know that many of their health complaints are likely related to their weight. Pointing those things out as though they were ignorant is insulting. Don't finger wag. Telling someone you shouldn't eat that or remember what your doctor said is also insulting. That's no way to begin a productive conversation about how you are worried about them. Don't use guilt as a weapon. Saying, "If you won't do it for yourself, do it for me," isn't helpful. This rarely works in any situation. Adding an additional layer of guilt or shame is not the way to inspire change. There's no perfect way to approach this type of conversation. Talking about weight and health is difficult. I've had many doctors ask me how to approach the subject with their patients, and that's their job. Sometimes the best thing you can do is simply be available and let them approach the topic. We put tons of things out on social, not because we enjoy doing it, but because we want to prompt conversations. Our hope is that you share some of these things from time to time in the places where you hang out, where the people you care about also hang out and may have a chance to see them and engage with them privately. Many of you have been asking why you haven't seen me in the clinic lately. As I'm sure you've gathered, the field of obesity medicine has been yanked into the public eye this past year, and all sorts of things are happening with insurance coverage, medication coverage, media coverage, you name it, it's happening. If you know me, you know that at heart I'm an activist. I am relentless when I see injustices happening in spaces where I know I can make a difference. As we close out 2023, coverage for obesity treatment and medications is a hot topic, with people and organizations all over the healthcare spectrum debating what they should do in 2024. As we saw this past year with Blue Cross, the big names in healthcare have a lot of power to do harm in this realm of medicine. I have a pretty big voice in this industry, and I have spent the past few months shouting to a lot of big players, not traditional health insurance companies, about the value of covering obesity treatment and covering it well. I don't know if my efforts will prove to be fruitful. I'm getting more and more traction every month, but I have to try. It's simply where I belong right now. I have hired and trained a group of amazing providers who can replicate what I can do in the exam room, and I have to trust them to keep doing that hard work day after day. For now, while I have the opportunity to make a difference outside of the clinic for people all over the place, I'm going to keep doing it. If you haven't already noticed, things around the office are changing. After years of hoping and advocating for better coverage for obesity treatment in the clinic, I have finally given up on being able to easily provide high quality care for people through traditional insurance companies. With all of the chaos happening around obesity treatment and anti-obesity medications, they have started to show their true colors. And it's clear that improving health outcomes is not at their core values. For the past few years, none of the major plans have covered health coaching or nutritionist visits. I had hoped this would change over time. We are doing the right thing after all, but things took a different turn this past year. Now, Blue Cross, our biggest health insurance company, is refusing to cover medical office visits if we discuss weight or weight loss for over half of their members. From what I've heard, it's only going to get worse next year. It wouldn't surprise me a bit if some of the other carriers took a page out of their playbook next year. In addition, for people with every type of insurance, copays have been rising rapidly, and more claims are going toward deductibles. 20 years ago, having private health insurance was a huge benefit. Now it's almost a joke. In fact, when I look at the numbers, most of our patients with health insurance pay somewhere between 50 and 75% of the total cost of the visits. That's crazy and disheartening because most people are paying for most of their care out of pocket already, and most people with Blue Cross are paying for all of their care out of pocket now. We are focusing on providing high quality care at a reasonable cost. Doing that means that we don't have to stay beholden to the stupid insurance company regulations, and we can expand the team. You've probably noticed that Lisa is now working as a nutrition coach. She has always had the education, training, and desire to fill that role. We have stopped waiting for insurance companies to include coverage for her services. Again, true colors coming out, and we are now offering her services to patients who are paying out of pocket for their care. She's a great addition to the clinical team and is helping so many people who need more than medical care, which in reality is almost everyone. Because some of you are missing me, and many of you haven't had an opportunity to connect with Lisa, she and I are going to be hosting monthly AMA, Ask Me Anything webinars for all of our patients. Our first one is scheduled for Monday, October 9th at noon. We are going to try and schedule them on the second Monday of each month, unless we have a rigid conflict. Watch your email for an invitation as the date approaches, and log on early if you want to ask a question. We will do our best to get through all of them. Because some of you are missing me, and many of you haven't had an opportunity to connect with Lisa, she and I are going to be hosting monthly AMA, Ask Me Anything webinars for all of our patients. Our first one is scheduled for Monday, October 9th at noon. We are going to try and schedule them on the second Monday of each month, unless we have a rigid conflict. Watch your email for an invitation as the date approaches, and log on early if you want to ask a question. We will do our best to get through all of them. Because some of you are missing me, and many of you haven't had an opportunity to connect with Lisa, she and I are going to be hosting monthly AMA, Ask Me Anything webinars for all of our patients. Our first one is scheduled for Monday, October 9th at noon. We are going to try and schedule them on the second Monday of each month,